All of St. Lucia's COVID-19 patients have recovered from the illness. That's the word from the Chief Medical Officer, Dr. Sharon Belmar George. According to the CMO, even patients considered at risk due to age and underlying conditions are on the mend.
To date, all of the positive cases of COVID-19 in St. Lucia have recovered, with the remaining 2 cases who were in isolation receiving negative COVID-19 results and have since been discharged from the hospital. This now places St. Lucia at the 100% recovery rate of all COVID-19 cases. Among the 15 cases St. Lucia recorded were individuals who fell within the category of high risk by virtue of some of them being elderly as well as living with chronic illness. They too recovered well with no complications or needed critical care.
Additionally, the island has adjusted the approach to testing by upping samples from respiratory clinics in a bid to better gauge the impact of the epidemic.
Laboratory testing for COVID-19 continues to be conducted both locally and with the support of the Caribbean Public Health Agency laboratory. St. Lucia has modified its testing strategy by increasing the testing on the number of samples from the community respiratory clinics. This would assist us in the assessment of COVID-19 locally.
The CMO reiterates the importance of maintaining the strict quarantine measures like the partial curfew and social distancing to slow the in-community transmission of the COVID-19 virus. Moreover, Dr. Belmar George explains that this tact, as well as an evidence-based approach to flattening the curve, can help inform policy to lessen the odds of a resurgence in cases when measures are relaxed in the future.
As seen in many of the more developed countries, even with an apparent decrease in the number of cases and the flattening of the curve, there have been periods of resurgence in their cases. When measures are relaxed and persons become more socially engaged, this provides an opportunity for smaller epidemic waves which are characterized by low-level transmission. It is with the benefit of this information we note the necessity of conducting a risk assessment to arrive at the evidence-based approach in relaxing measures while ensuring the capacity to detect and manage a possible resurgence in cases moving forward. Everyone is asked to note that as essential services are made available to the public, the guidelines for social distancing need to be adhered to at all times in the interest of the health and safety of the public. In the context of this, we all need to be reminded that the threat of COVID-19 still exists and will continue to be with us for a while.
The CMO continues to advise the public to focus on the maintenance of standard recommendations to prevent the spread of infection, including hygiene practices and physical distancing. Colby DeVoe, HTS News Force.